Welcome to this clinical walkthrough on the open-angle glaucoma case for UCAMLA, brought to you by Medi8, your 24/7 practice partner.
Right, let's set the scene for your OSCE station. Your task is to counsel a patient who has a new diagnosis of open-angle glaucoma. Now, the crucial piece of information here is that this was found during a routine eye test. That means your patient is probably feeling fine with no symptoms, so this diagnosis is likely to be a huge shock.
So, first up, breaking the diagnosis. How you handle this first step is absolutely critical. It really sets the tone for the entire rest of the consultation. Let's walk through a solid structure to follow. A simple three-step process is your best friend here. First, always acknowledge what the patient has told you. Then, you state the diagnosis clearly, without any confusing jargon. And finally, you explain what it all means in simple, easy-to-understand terms.
And here is the exact phrase you're going to use. Commit this to memory. Based on what you have told me and from my assessment, I suspect you have open-angle glaucoma. It's perfect. It shows empathy, it's direct, and it links what you found to your conclusion. Do yourself a favor and practice saying that out loud until it sounds completely natural.
So how do you explain this condition simply? You can tell the patient it's about high pressure inside their eye, and that this pressure is causing some damage to the optic nerve. Then explain that the optic nerve is like a cable that connects the eye to the brain. This damage is why they might be having some issues with their side or peripheral vision. It's a simple analogy, it's effective, and it skips all the complex medical speak.
Okay, so you've delivered the diagnosis. The patient's immediate next question is going to be, so what happens now? This takes us right into the management pathway.
You need to be really specific here. Explain that you are going to make a routine referral to a specialist eye doctor called an ophthalmologist. Using that phrase routine referral is so important because it avoids causing any unnecessary panic, and it also shows the examiner that you understand the correct urgency for this condition.
Naturally, the patient will want to know what this specialist is actually going to do. Let's break down the key investigations you'll need to explain to them.
You should name these 3 specific tests. It shows you have a thorough understanding. They are gonioscopy, a visual field test, and an optic nerve assessment. Let's quickly go over what you'd say about each one.
When you mention gonioscopy, you can explain it as a special examination where the specialist looks at the drainage angle of the eye. This is just to see if that angle is open or closed, which tells them how well the fluid is draining out. Simple as that.
Now this is a massive safety point, and honestly an easy mark to score in your OSCE. You must tell the patient that eye drops will be used to make their pupils bigger for the tests. Explain that this will affect their vision for a while and they won't be able to drive, so they absolutely have to arrange for someone to take them home from that appointment.
And look, knowing all these steps is one thing, but actually doing them smoothly when you're under pressure in the exam is something else entirely. You can practice this exact case right now and get objective feedback on mymedi8.com.
All right, let's talk treatment. This part of the consultation is all about managing the patient's expectations and making sure they understand that they have a huge role to play in the treatment plan.
This phrase right here is absolutely vital. You have to be upfront and honest about what treatment can and cannot do. You need to state clearly, treatment can't reverse any loss of vision that has already occurred, but it can help stop your vision getting any worse. This is a cornerstone communication skill. Explain that the main treatment is going to be eye drops, and their job is to reduce the pressure in the eye. Now, the most important point to hammer home is adherence. They must use the drops exactly as directed, every single day, even if they don't feel any different. You have to stress that their sight is at risk if they don't.
And give them a practical idea of what to expect. You can tell them the drops are normally used somewhere between 1 and 4 times a day.
To really show the examiner the breadth of your knowledge, you should also briefly mention that if the eye drops don't work well enough, there are other options. Things like laser treatment or even surgery are available. This is great because it reassures the patient that there's a clear plan B and C if needed.
Okay, we're nearly there. Before your patient leaves, you must give them some clear safety netting instructions. These are totally non-negotiable, both for the patient's safety and for you to pass the station.
You have to cover these 3 things. Number 1, driving. Advise them they need to wait for advice from their specialist and from the DVLA. 2, red flags. Tell them if they experience any severe eye pain or redness, they must come back to the hospital immediately. And 3, follow-ups. You have to stress how important it is that they attend all of their future appointments.
All right, let's finish with a quick, high-yield clinical recap.
This is to really cement the key differential diagnoses in your mind. Getting this stuff right is what separates a pass from a high pass.
Look at this comparison. For open-angle glaucoma, what do you need to remember? It's painless, it's a routine referral, and you need to exclude red flags and think about things like diabetes. Now, contrast that with acute angle closure glaucoma, a completely different beast. Here you've got severe pain, maybe a headache, it's an urgent referral, and the management involves specialist meds and surgery. Knowing these differences cold is absolutely key.
So, after going through this entire structured approach, you've got to ask yourself, are you ready for your OSCE?
The only way to know for sure is to put it into practice. You can practice this exact case now on mymediate.com. Good luck.